Welcome everybody to the first crisis hour, Thursday the 21st of January. It's 1 o'clock or 1300 in the UK. I'm in Somerset at Weston-super-Mare at the seaside. Some of you are scattered in different parts of the globe, largely from the UK. This is the first one of the Institute of Civil Protection and Emergency Management's crisis hours. We're planning to run one of these each month. You should all have received, you can see the slide in front of you. You should see a little blue picture. Everybody should have received the flyer in the last couple of days explaining who our three speakers are, or at least a bit of information about our three speakers today. So I'm not planning to go through all that. We have got 1 hour. It is going to be pretty tight, so no apologies for that. So welcome. My name's Tony Thompson. I'm the Director for Events for ICPEM. For those of you who don't know me, we hope you will come back and join some of our ICPEM events in the future, and in fact even join ICPEM. So today, the topic for today is how should emergency managers define good practice in the disaster risk governance of a pandemic? And we have three speakers, and the first speaker today I'd like to introduce is Professor David Alexander from University College London. Welcome, David. David is talking to us from Italy, so the signal looks very good. I'll pass you over now to David.
Good afternoon, good morning, good evening, wherever you may be. Good day, and let's look at some possible lessons from what we've all just had to endure and go through. And we'll have to do so rather quickly so we can have a discussion of that. Of course, we're talking about lessons learned, and you can find lots of publications with that in the title. But the fact is that if a lesson is learned, then there is some measurable positive change to prove that it's learned, rather than the lesson simply being put into a drawer and forgotten, or at least put onto a hard disk and completely overlooked. So utilized, adopted lessons are those that are learned because there is positive change. And it's not a simple matter. What incentives are there for us to learn at all? Who is going to ensure that we do learn? Are the lessons that are learned actually in the public interest or in private interests? Are the lessons culturally acceptable? Are they sustainable, or are they going to be forgotten in the not very distant future? And what is the influence upon these lessons of the uncertainty and unpredictability that is very much a feature of many of the things that we deal with? Those are open questions. There is no absolute answer to them. When we're dealing with COVID, for example, you could argue that it is a predictable and anticipated disaster, except that in many respects it was not. Yes, we did have the emergency plans. Yes, we did have the scenario for it. But in many ways, it was a predictable disaster that was not predicted, or at least it was not anticipated by those who could have, and I would argue should have, listened to the predictions. We had the scenario for it in 2008, if not before, as a result of intensive research in that decade over what would happen in a viral pandemic. And of course, it is rather complex with all the different effects and the connections between them, the cascading effects, the environmental changes of the environment of COVID and the people who suffer it and have to deal with it, the need for new policies and legislation, the problems of communication, the bad communication, and the outcomes of this. But I would like quickly to go through 10 lessons and to pick on about 3 of them for a slightly more amplification. Firstly, it is clear that viral pandemics are recurrent. Influenza has an average return period as a pandemic of 35 to 40 years, except that it is not evenly spaced. We need to observe the situation in other countries. Yes, most definitely we do, because that way we can learn what we need to do in our own country. We need to act promptly and decisively. You can see many instances where that lesson is demonstrated largely through negative acts, namely the failure to act promptly and decisively. Having a good civil protection system that I believe in Britain needs to be upgraded. And the lesson to me seems quite clear about that. The better the civil protection system, the more you can deal with this at all levels, including local. The need to harmonize local and regional response. Those countries that have dealt with it best, I think, are those that have had adequate and decent local and regional organization and the ability to harmonize that from above. Yes, it does exacerbate the tension between centrism and devolution, between national and local, but we need to get around that and to ensure we have a fully functional system with emphasis on the local level, because that is the theatre of operations of all disaster. Defining and protecting key workers is clearly important. One thing that I have been batting on about for quite a while since the start of the present crisis is to try to improve the role and the status of emergency planners, emergency managers and risk managers. Where they have been overlooked, what we've seen is a far worse disaster with the waste of billions of pounds, dollars, shekels or whatever. And that is because much of what we are dealing with as an emergency requires the skills of emergency planners and managers. I absolutely don't mean myself. There's nothing I'm much capable of managing, but there are real experts out there whose expertise is being underutilized. Communication is part of that discourse and is absolutely vital. Where it has been bad, where it has been inconsistent, then you have seen some of the most severe problems with this pandemic. Welfare is something we need to define. Politicians don't define it. It is not expedient for them to define it, because if they did, they might have to honor the provisions of the definition. But we need a better, more comprehensive description of it, because welfare is part of the solution to the problem. It stops social unrest, it preserves the economy and does much more. It also ensures human rights. And pre-planning, vaccination and the recovery, the two sides to this in which there was no scenario or no adequate scenario beforehand, although there was research on both. So we need a good civil protection system. That means a functional basic law. In the United Kingdom, the Civil Contingencies Act has been sidelined in all this business. That is not a good sign. That is not how it should be, because a basic law will specify the system and how it is meant to work. If it works in a different way and is a different system, then something needs to be adjusted drastically and rapidly. It also enables us, a civil protection system enables us to develop capacity at the local level where things actually happen. It enables us to connect up government in various ways, because this, of course, is a matter of whole government and whole government at all levels, national, regional and local, if not also international. A better role for emergency planners and company, because we have seen that although plans were made over the period 2005 to 11 or 14 anyway, roughly 10 years after the previous SARS episode, then there has been a gulf between the plans themselves and their implementation, especially in stockpiling, communication logic, and much more. Supply chain logistics needed more attention. They have been invented and improvised, and the result has been inefficient. It is complex to deal with this. You can see how the outside influences around the edge of the diagram affect the processes and the connections within the diagram. Hardly surprising, therefore, that this needs to be thought through very carefully beforehand, rather than improvising it during the event. Communication and role models. We see where communication has been bad in the sense that it's been inconsistent, unclear, and infrequent, that this has created immense problems. Major figures need to act as role models. Where they don't, then we see a loss of trust, and that invalidates, cheapens, or otherwise sidelines communication. And it means that when vital instructions are communicated, they're not necessarily acted upon, because those who communicate them are not acting on them themselves. Major figures, major politicians and celebrities are indeed role models. They must act as role models. Welfare needs to be defined, support for it needs to be defined, problems of equity need to be solved, and welfare stops all sorts of things from riots to inequality to the loss of people who are on the front line and so on and so forth. Lastly, a quick word about vaccines. We tend to treat vaccines as if they're just an ordinary commodity, rather like distributing broom handles, having manufactured them, stockpiled them, and so on. But in fact, it is not so. Vaccines are not normal commodities. The process of manufacturing vaccines is complex and unstable. It requires considerable skill, constant checking both within the plant that manufactures them and outside it. And normally setting up the manufacturing chain for a vaccine would take us up to 22 months. And that assumes that the vaccine is already approved for use. This, of course, has to be done at breakneck speed at present. Things, however, some things that are a problem in vaccine creation, distribution, and usage are not a problem this time around. For example, normally vaccine manufacturers have to predict demand. Demand is insatiable at present. Therefore, batch sizing and shelf life are not a problem. Cost benefit is not a problem. The world has to have these vaccines and it has to have them now. So at least some things are not a problem, but others are. There are risks associated with each step of the process. Vaccine plant in the wrong location for speedy and efficient distribution. Plant failure at the point of production design. Quality control issues. That is absolutely vital. Vaccines have to be adequate quality. Allocation of batches, inability to satisfy demands, currently a hot potato in continental Europe. Distribution capacity disruption. We've actually had bad weather and that has had a disruptive effect. Pardon me. Cold chain problems, of course, particularly difficult where a vaccine has to be kept at -70°C. Refrigeration failure. There was one case in Italy where somebody accidentally pulled the plug out of a refrigerator and away went 800 vaccines. So these can be possible problems. And then the actual process of vaccinating people and the medical ethics behind it. So these are just some of the issues. I've tried to stick closely to my time and therefore been rather breathless, rather synthetic, but hopefully we can debate this a little further. So thank you very much for listening.
Thank you, David. That's fine. We'll go straight on to our next speaker, who is Professor Lee Miles. Lee.
Well, thank you for David for a panoramic introduction and covering many of the main issues. And it made my job considerably easier as the second speaker. And what I decided to do, in a sense, was assuming that this would be the case, that I would actually delve into one of the major issues which I perceive as being very important from the UK perspective. And it's actually hitting very hard on the issue in relation to what David was talking about. It was that fundamentally a successful emergency management system requires national harmonisation and strong local capacity within it. And in the UK context, and I'm going to speak principally about the UK here, of course, we are in an interesting factor in itself, because of course one of the factors that the public have become very much aware of is the notion of devolution in disaster management, you would say, and in practice the role of the nations rather than the nation state, the all UK approach, in actually dominating their lives, from the rules of COVID to the periods of lockdown, through actually, in the case of more recent issues of how much stockpile individual nations have of vaccines. So in that sense, it's become very much a focus on the Welsh or the British or the English or the Scottish nature of COVID rules alongside that. And that's something in many ways that we've been aware has been around with the CCA 2004 Act, but of course with the Coronavirus Act of 2020, this brought in a much greater focus on the devolved administrations. And I guess what I'm sort of thinking about here is, well, what does the pandemic experience mean for the contention that, as we all say, all disasters are local, and in many ways good emergency management is built from the ground up and requires an integrated response, as David was talking about, from the local to the regional to the national to the international. And really, why is this important? Well, I think it's important because we're almost in a unique laboratory position. And actually, some of the things that David was talking about are an illustration of that. For me, in many ways, we're in a distinct operational mix because, of course, not only do we have COVID-19 as a long burn health crisis, as a pandemic that is being dealt with, and really in many ways transitioning from a long burn health crisis to maybe an embedded issue for the future, which we may have to deal with annually in seasons. And of course, alongside, so we have a longevity of which to look at this, of which the devolution issue has come to a fore, in my view, partly because of that. And secondly, of course, is the notion of the intermittent nature of the COVID response, which has been that many of the instruments are featured in terms of waves and as part of our traditional approach of dealing with pandemics. And that means that in intermittent lockdowns, of course, being an obvious case. So we have short-term instruments and a long-term health crisis or scenario. But alongside that, of course, as we know over the last few days, and sitting in Dorset and maybe Tony in Somerset, you know, we are aware of the rains and the issues. The notion we are facing, in many ways, for the first time, at least in the public environment, the notion of a multi-hazard scenario as being much more important. We faced that in the work in Africa, for example, for many years, but fundamentally a notion of facing simultaneous, often annual short burn hazards, in our case flooding, in a COVID-19 pandemic environment, which has both operational considerations to that. And I'll allude back to that in a moment. So we have in many ways a differentiated notion of a pandemic. We have a multi-hazard scenario, which has become much more aware. And in many ways, and I think touching upon what David's were talking about, we have in many ways a transient legal environment and framework. And what I mean by that is, of course, and I think I would agree entirely with what David's saying, that the Civil Contingencies Act of 2004 has been partly sort of ignored in many elements, or has been, let's say, not operationalized in the way we would like. And the introduction of the 2020 coronavirus, which was really a shopping list of issues that needed to be dealt with, has in many ways created issues of incompatibility or tensions between those two frameworks. And of course, we also have the wider political trajectories, which emergency managers need to be aware of in terms of Brexit and of course, devolution itself. And what I'm saying in many ways is that for me, this has, there's four major challenges when we talk about good practice. And I'm going to focus on this one particular issue, which is about how we balance or reconcile our principles of the integration of emergency management, which is a core principle, which you could say is an integration imperative, with in many ways, which could be seen as an all nation state or UK approach, with emergency management by nations, a devolution imperative. Now, let me be clear. I'm not saying it's either or, far from it. We need to have both as part of our integrated system, as David would say. But in many ways where we are today is in that the way this has unfolded, partly because of the pandemic, is in many ways we have a very kind of incremental, very messed situation. And I think there's four major challenges which I would bring to the group for discussion. First is our notion of a multi-approach, and I'm going to use the term multi a lot in this, a multi-approach challenge, in that we're trying to reconcile the pandemic structures, often associated with public health emergency management, but often given greater teeth by the Coronavirus Act of 2020 and the legislation before it, with the kind of all hazards dimensions of where we come with legacies of the Civil Contingencies Act. And in many ways, they should not be incompatible. But what we have seen is that in many ways, because of a lack of full implementation structures on either, we have a kind of very mix where a lot of operational questions are being, as David said, made up as they go along. And then we have our multi-agency challenge, which is really clarifying the challenges and role of stakeholders. And for me, I use the term the decline of the Civil Contingency Act, but maybe the incomplete implementation of it, that it has lost some of its focus, has meant we have faced major issues at the local level in particular with our governance framework, from resilience forums all the way through to really the profile of local emergency management planners. And a good example of that would be, of course, the case with the discussions and tensions between Manchester and certain English regions and local governance and the UK government within our structure. And then we have what I use the term multinational, but what actually means is multi-level, which is addressing what we see really as assertive devolution really through the emergency management structure that the 2020 Coronavirus Act really gave or extended powers to and solve some of the issues around for the devolved administrations, but it has been taken very strongly as enabling the devolved administrations to play a very strong role. So we started out very much with the idea of a four nations approach, and I think everybody would universally agree we've moved away a long way from that really to really a one nation as opposed to a one nation state or a four nations approach. And that goes from anything from tier rules to lockdowns to issues around vaccine stockpiling, all the incoherence and tensions that are created by an incomplete implementation of two parts of the structure that we have. And finally, for me, it's really the multi-hazard challenge that this comes to a head, because what this has meant is we are faced with real issues about filling the gaps in operations. And really what we have faced really, as we've seen in the last few days, is the challenges of dealing with multiple types of hazard in a COVID-19 environment. And the obvious point I would make there, and actually was something that David illustrated very strongly at the end, which is the notion of the crisis communication. We had over the last few days lots of information on alerts about flooding, but information about evacuation and how that was to be dealt with in terms of a COVID-19 environment, about the challenges of using evacuation if you evacuate from areas, leave your home, which you're not supposed to in COVID-19 rules, and where do you go and what kind of rules, that was far less clear. And there's a good illustration of the challenges that we face in that particular environment. So what are the issues for the future in my last 2 or 3 minutes, because I'm conscious of time here? Well, I really want to say that we really have a number of issues. First, we have the issue of addressing integration itself as a core principle, that it's going to rear its head constantly, and it's something that we need to be part of future reviews. So we need to resolve any incoherence in the UK emergency management structure between the tensions between the legacies of the 2004 Civil Contingencies Act and the 2020 Coronavirus Act. And that means in practice, and I agree entirely with David, we are going to reach a point when things settle down and needing new legislation or really a strong focus on the frameworks to try to synergize any structures better. That should be part of our lessons learned structure, but that is not always the case. We need to recognize our second point of assertive devolution, that we are in a process where emergency management by nations has become a major factor. And it should be part of our system, but actually, in a sense, has assumed a very strong role in the position that we face around the pandemics. And therefore, we need to reconcile these two principles of integration and devolution in our future emergency management lessons learned in a much stronger way. About that the pandemic has heightened the one nation, and there I mean Wales, Scotland, as opposed to a one nation state or UK approach, in my view. And is this the future? Well, of course, we need to talk about that and reconcile that in any future structure. And we also need to reassert the whole hazard scenario. We were lucky in many ways that Storm Christoph didn't affect the entirety of the UK. It affected most of England and parts of Wales. But there are illustrations about a lack of operational problems when you have a nationwide impact, but you have deviations of rules, both in COVID and in terms of flood management. So in a sense, I'm not saying I'm a centralizer, but I think there are some important lessons that we need to learn or think about when we talk about our blue skies look at where we are in the future. I think the first point is really and reinforces David's message that the pandemic has brought multi-level governance issues about the distribution of power and responsibilities across the levels to a stronger focus. And it's also led to some real questions about, do we really have all the operational tools in place, which emergency managers are supposed to have to deal with an all hazards approach? We've been lucky, I think we haven't faced those yet. And finally, our second lesson is that this incremental approach that we've adopted at the moment, which is filling the gaps as we go on, can only be transitory. The wider political issues around devolution, which will mean in many ways the need to focus on the relationship between integration and devolution in our emergency management system, will become increasingly stronger. And our final lesson really is that in many ways, I would argue that from the emergency management perspective, we've been kind of sleepwalking into the full devolution of UK emergency management. Now, I'm not saying whether that's good or that's bad, but clearly there are clear junction points with the Coronavirus Act of 2020, where the devolved powers have been much stronger, are now embedded, and have been asserted by the leaders of the devolved administrations, which will mean that any revision will need to be very, very politically sensitive in the way that it moves forward. And I'm conscious I've probably just reached my 10 minutes there, so I'll stop there. But really, just to reinforce that for me, as part of this review and of lessons learned and this new framework, which I think myself and David agree are fundamentally important, at the center of this are core principles. And the core principles of how we operationalize integration and devolution are, for me, one of the major challenges for the future. I'll stop there. Thank you very much indeed.
Excellent. Thank you, Lee. Just to remind everybody that we will be sending you a link to the 1 hour presentation. So all the materials, you've got a lot of information so far in the first two speakers. So all the 3 speakers' presentations will be provided to you in the next couple of days. So you'll be able to refer back to them at your leisure. And now move on to our final speaker, who is Rob McAlister. Rob, over to you.
Thanks. I'm going to actually start off with my question and then backtrack. My question to you all when we actually get to the breakout rooms is, what changes are needed to reverse the culture where other nations have utilized and led using the UK expertise? And what I mean by that is I've spent, as I'm sure all of you on this call have spent, considerable time working overseas, working internationally, giving good practice, whether it's your own country or it's the UK's. Mine obviously has been the UK. And as late as October last year, we were being heralded as being number 2 in the world in preparedness behind the US in how we were going to tackle a pandemic. In 2011, the WHO actually looked at our pandemic strategy and felt it was world class. Since then, and I think throughout my entire career, we have been seen in the UK as a centre of excellence for crisis, disaster and emergency management, rightly or wrongly. So really, I suppose my question is how did we not utilise our own expertise as well as we could? In fact, there was an article in the Times by Professor Martin Hibbard, who'd spent considerable time in Singapore during the early 2000s. And I think he hit the nail on the head. He said basically Singapore took the UK's pandemic plan verbatim. The only difference was they actually introduced it and actually made it work for them. So they actually took the plan, made it work, and it seems to have been paying off. Obviously, some of the countries that we have been advising over the years also seem to be outperforming us currently, which is an interesting one. And sat on the sidelines for the last year, it's been incredibly frustrating knowing how much expertise, and I think Lee and David have both said this during their presentation, we have so much expertise. We are very good at this. So how were we not able to use this expertise on ourselves? What were the barriers to that? Why are we so good at giving advice and telling people how best to do this? But when it came to ourselves, we seem to have not failed miserably, but we haven't done as well as we, I think, would have expected. And I'm going to keep us on time because I'm actually genuinely interested in the breakout sessions and to see what everyone else has to say. It would be really interesting to see what the international people on the call have to say, because they're on the receiving end of all of this great UK best practice a lot of the time. So thank you very much. Hopefully I've got us back on track timings wise, and thank you.
We're now going to go into the breakout rooms where we have 3 questions. You should be able to see these 3 questions. You've already heard Rob talking about the question 3, what changes are needed to reverse the culture where other nations have taken the lead using UK expertise? So we're now going to put you into the breakout rooms for about 15 minutes where you can discuss. So. Okay. Right, everybody. Well, welcome back. It was fast and furious. We ended up with 7 rooms. I dipped in, as did my colleagues, into several of the rooms. It was good to hear a lot of discussion going. Those are the 3 questions. Now we've got a short period now just to wrap up, and for if I could ask the rapporteurs or the leaders of each of the groups if they have a question that they'd like to put, or a comment relating to those questions to either or all of our 3 speakers. Please go ahead. Perhaps we can start with meeting room number 1.
But I think some of the main points that came out of our group was about how we actually plan, and can we do that better in terms of planning and training, because plans tend to be documents that sit on shelves, but we're good at planning, but we're not good at practicing the plans, and perhaps that's something that needs to be looked at as an issue in the future. And the thing at the second question about incompatibilities between central government and the devolved administrations in the UK, I think the pandemic highlights the issues that arise when you're dealing with a devolved issue, because health is devolved in the UK. So, and I think that's one of the reasons why there are some political reasons, obviously, why the government decided to bring in new emergency legislation rather than use the Civil Contingencies Act, because the Civil Contingencies Act applies to the whole of the UK. So had there been, say, a widespread issue, say a terrorist event that was widely spread across the UK, I think probably the CCA would have been invoked. Because this was very much a health issue, I think that may be one of the reasons the government decided in the UK to bring in new emergency legislation. So we talked about some of the complexities around this coronavirus pandemic, and in question 3, why, although other nations tend to sort of take the lead using UK expertise, and I think Rob used the example of Singapore. However, Singapore went through SARS-1, so I would imagine, although I'm not sure, that they may have also used our pandemic flu expertise, but also their expertise from managing the first SARS outbreak 2003 to 2004. And one of the things that other things we discussed was that none of us are different, because a lot of the experts and the scientific expertise and the planning for pandemics was based on how a respiratory virus normally acts, like a flu virus. And coronavirus is acting in a very different way. It has a few more tricks up its sleeve, because it can be transmitted by airborne droplets, which is a bit more unusual for a respiratory virus. So there are sort of a number of factors that, and a lot we can learn from dealing with this pandemic for dealing with pandemics in the future. I think some of the main points were about getting better at practicing the plan and trying to make emergency managers more involved in that process in supporting the scientific and the clinical expertise.
Thank you, Karen. Can we go to room 7 now? Tony Moore, can you connect with us, please, and give some comments?
Well, I had an interesting group, because I had one from Oman, one from Japan, who's currently here in the UK, and one from that independent island just off the south coast of England, from the Isle of Wight. I mean, the interesting thing about the Isle of Wight was it was a tier 1 problem until the holidaymakers came across from the UK. And there was the ferry, apparently there was lack of communication to the ferry companies about what they should do and this kind of thing. But I think Oman seemed to have handled it pretty well. Although the big lesson that came out of Oman was the need to involve the community at a very early stage, I think, and that perhaps wasn't done. And I think probably the same applies here. How well have the community been involved? But the big lesson for me was the lack of consistency in the communications coming out from government, and the lack of what I would call solid decision making. Just a brief summary, Tony.
Lovely, thank you. Thank you very much. If we can go down to room number 6, and is Burkhak there, please? I hope I've probably pronounced your name wrongly. I apologise.
It's like chair. Uchak.
Okay.
Okay, thank you. I'm going to combine the 3 questions to save the time. So the key findings from our discussion, it was great. Like we had 2 participants from UK and one from Oman, who is based in UK, and I'm in Turkey. So the common point is the language used by emergency planners needs to be very clear. So like this morning about floods and coronavirus, it was clear once what it was said, but it was not the same at the beginning of the pandemic. So the message given to the community, the correct message, right message given to the community at the beginning of the pandemic could have been better. In the UK, I think it's the same everywhere. It was kind of underestimated, like people thought it is like a flu, but that's not a flu, that is a coronavirus which can kill you. So that message should have been given at the beginning of the pandemic as a central message, and one blanket message for the whole country. I like that statement very much from Louis. So there should have been a common message, common goal for the whole country, not like different rules and regulations with different parts, because that was confusing for many people. Leadership during the disaster emergencies in the UK and everywhere in the world could have been questioned. So we need strong leaders with strong disaster governance skills to manage pandemics. Again, changing messages from the beginning of the pandemic until now made it very confusing for the community to understand the level of seriousness of this virus. And lack of integration between central and local authorities was kind of not as an issue. And trust to government. So trust is another parameter to manage pandemics from our discussions, if I summarize them correctly, my friends. Thank you.
Lovely. Thank you very much indeed. We've got a couple of minutes. Tom Pine in room 5. Do you have any feedback, please?
Well, we didn't get very far past question 1. And I think that this is much too serious, a series of questions to answer in one session like this. I think what we can say is that the standing and profile of emergency planning is dropped considerably, and maybe it's cyclical. Maybe this year will bring it back again, but at the moment, I don't think it's even a graduate profession anymore. So not very positive, I'm afraid.
Okay, thank you, Tom, and that's useful. And you make a very good point about the complex subject with a short time. Room number 3.
All right. So in summary, what we did, we saw that the issues of interconnectedness between agencies and was an issue. We saw that there was a lack of ownership. So there was a division between who owned the problem. And while in normal circumstances, the police would have been the forerunner in terms of owning an event, when it came on to this particular issue of the pandemic, we saw that it was a matter of NHS, but yes, we needed support. So the whole thinking of that we are all part of the same pie, as in i.e. UK or whichever destination or country you're part of, there is one country. And we're all trying to support the goal of trying to eliminate this pandemic. So we all need to work as a supportive team. But I think there was a little bit of, who takes the lead? Is it emergency planners? Is it NHS? And in supporting NHS and supporting the health professionals, I think the emergency planners were sidelined. And the principle of emergency planning still needed to be applied to how you handle the pandemic, but yet still it was more putting the NHS and the health professionals forward and not recognizing that everybody needs to be supportive of the thing and the principle of how it operates as a emergency needed to have still been put in place. We also saw that there was a matter of, because there was somebody in our group who was from China, and she talked about just back the whole thing of compliance. So again, the Chinese mentality of and cultural thing about being compliant and listening to authority, versus again how the British operated was again also in a way that other nations have taken things on and are able to push it through. Again, so the cultural aspect was also at play in our discussion. But that's a summary of what we pretty much spoke about.
Fantastic. Okay, well, look, thank you very much indeed. We have come to the end of the time that we've allocated for today. It's now 2 o'clock, well, 2 o'clock plus 1 minute, I think, or thereabouts. Thank you very much to our speakers, to David Alexander, Lee Miles, to Bob McAlister, and in particular, thank you for taking part. As I said earlier, this is the first one. We'll work out any lumpy bits, and next time I'm sure will be a lot better. Look forward to any feedback you have, and I'll send you a link in the next couple of days so you can study it at your leisure. Thanks very much, and stay safe, and hopefully see you again soon.